Best way to improve pharmacy inventory is to make sure that throughout time that you have a consistent method or a snapshot to give you an appropriate valuation. If you're doing all these internal solutions, they're essentially patches or whatnot. You fix them as you go, and then as new problems occur, new internal solutions have to be done. With an outside inventory service, it's the best way to give you a consistent snapshot based on a timeline of preference to truly know where that valuation is going. Many pharmacies do have small tweaks or minutia or details on how they solve problems, but because of the nature of certain drugs and the nature of certain products that have the tendency to create the most problems, we have familiarity with, like an Addie's connection with a vial and a bag. Those are a consistent product everywhere, but because it's essentially a kitted item, it therefore ruins the consistency of tracking that product because it's two products attached to one. So that's an example where, yes, a hospital will have slightly different products that you might have in your inventory, but the problem solving and the expertise that we've learned and the strategies that we've learned to solve for that valuation, we're very familiar with. We see that our customers prefer that we take care of it, and it's from 2 points of perspective. One, operationally, hospitals, the operations and procedures are very important. I mean, you have patients to take care of. And then the other is a skill set. So for example, technically you could, fix your own roof, but that does require a skill. It does require know-how. We have gone in and see the inconsistencies from the drug ordering or from the dummy number procedures in-house and all the other in-house solutions that try to attribute consistent product codes or consistent valuations. The people on the floor aren't familiar with that. So that's something where we have the know-how and we've done it again and again. We can do it in a very short amount of time as well. So it's not as cost beneficial that we've seen for a hospital to try to internally do all this stuff, because since there is a skill set involved, there is a know-how, there is a separation of know-how from working with drugs on site to the actual finances with drugs. Just trying to grab someone from on site, we've seen, hasn't been the best operational solution for hospitals, because when you go into the back end and seeing some of these inventory solutions or patches, it brings up a bunch of headaches, it brings up a lot of roadblocks, and because we've seen these roadblocks, we know how to tackle them, and we know how to make everything precise as possible, but also in a very efficient way.